Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone, and sorry for the long wait. Welcome to the third International Continuing Medical Education Series, IPE from Basic to Practice. My name is Amalina Sabrina, but you can call me Sabrina, and I will be your Master of Ceremony for today's event. I would like to personally welcome our distinguished speaker from Monash University, Australia, Associate Professor Dr. Fiona Ken. Good afternoon, Dr. Ken.
Good afternoon. Terrific to be here.
Is it already evening in Australia?
The sun is going down. You can probably see going down through the window. So it might get dark while we talk.
Okay, I see. Thank you for joining us today. It is a pleasure to have you here. And I would also like to welcome our second speaker from Universitas 11 Maret, Dr. Amanda Boitimore, Master of Medical Education. Good afternoon, Dr. Boy.
Yeah, good afternoon.
Okay, it's so nice to have you here.
Yeah, I'm also nice to meet all of you.
Thank you, Dr. Boy. I would also like to welcome the Honorable Professor Reviono, Pulmonary Specialist as Dean of Faculty of Medicine, Universitas 11 Maret. Good afternoon, Professor Reviono.
Yeah, good afternoon. Yes.
Thank you for joining us.
Yeah.
And also Dr. Paramasari, Dr. Dia, and Dr. Selvi as Vice Dean of Faculty of Medicine, Universitas 11 Maret. I would also like to welcome our moderator for today's discussion, Dr. Widana Primaningtyas, Master of Public Health. Good afternoon, Dr. Widana. Is Dr. Widana here? Okay.
Yes.
Hello, good afternoon, Dr. Widana.
Yeah, good afternoon. How are you, Amalina?
I'm fine, thank you.
Yeah, thank you.
Okay, and for all audiences, welcome and thank you for joining our third International Continuing Medical Education Series. We are delighted to host this event. Ladies and gentlemen, here's today's agenda. First, we have an opening session, which includes prayer, the playback of Indonesia National Anthem, and an opening remark by the Dean of Faculty of Medicine. And second, we have a virtual photo session. And then our first lecture with Dr. Fiona Ken, followed by second lecture by Dr. Amanda Boitimore. And last is the Q&A and also discussion session. That's all for today's agenda. Ladies and gentlemen, let's take a moment to pray for the opportunity God has given us today. Pray begins. Pray ends. Thank you, everyone. Next is the playback of Indonesia National Anthem, Indonesia Raya. For all audiences, please take a moment to listen thoughtfully. Thank you. Thank you. Next, we have an opening remark by the Dean of Faculty of Medicine, Professor Fiona, Pulmonary Specialist. To Professor Fiona, please proceed. Thank you.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning, good afternoon. It is with great honor that we are here today. To attend this webinar, I would like to welcome an honorable speaker from Monash University, Associated Professor Dr. Fiona Ken. Good afternoon. And also second speaker, Dr. Amanda Boitimore, MD, and Honorable the Head of Medicine Study Program, Dr. Eti Poncorini, MPD. Again, this lecture held by the Medicine Study Program, Faculty of Medicine, Universitas Maret, by hosting this live webinar with the topic, the third International Continuing Medical Education Series, IPE, Interprofessional Education, this from basic to practice. We aim to improve knowledge of the faculty member to design and evaluate collaborative care curriculum to facilitate students in the interprofessional learning and to promote the progression of professional identity through collaborative learning. Okay, ladies and gentlemen, we really appreciate the initiation, the activities carried out by this initial collaboration of the Faculty of Medicine, Nursing and Health Science, Monash University, and Universitas Maret. We hope this initial collaboration will continue with further activities and will be beneficial not only to the institution, but also to the communities. Well, as Dean of Faculty of Medicine, Universitas Maret, I would like to thank the speaker and committee for preparing this event. And now I officially declare the third International Continuing Medical Education Series, IPE, from basic to practice to begin now. Yes, thank you to the speaker, committee, and all participants enjoying in the host training. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Professor Fiona, for officially opening today's event. Ladies and gentlemen, next is a photo session. We kindly ask everyone to turn on the camera for a virtual photo session.
And so can everybody hear me okay? Terrific. Delighted to be able to present this work. This work is the topic of my PhD, the topic of all my work and my research, and it's extremely rewarding, so delightful to share it with you. I need to also acknowledge the country I'm on. I acknowledge the traditional owners of the land I present from today, the land of the Bunurong people in Melbourne, Australia, and pay my respects to elders past, present, and future. So what I'm going to try to do in 40 minutes is tell you a bit about our context, because the context impacts what the curriculum looks like. I'm going to tell you about the curriculum framework, so how we introduced interprofessional content across our university. I want to tell you about the programs we've developed, just a little bit of detail about what the students actually do together. I'm going to talk about, I've called it recent innovations, but it's really how COVID demanded we shifted and what IPE has looked like in a COVID world. I'm going to talk about identity development because that's fundamental to some of this content, and the specific skills of facilitating an interprofessional group as opposed to just your own single profession. And I'm just going to touch on evaluation because this journey for us has taken some time and now we're starting to evaluate. So you know where I'm coming from. I'm Melbourne, down the bottom of Australia, where we had horrible long lockdowns. So I've been living at home for a long time. So it's great to be in the office. And this is the university that I'm on now with some fantastic teaching spaces. So we have some big spaces where students from different professions can come together. For context, we've got 12 health professions, but they're not all at the same place. So where I am in blue at one campus, there's the medicine course, the nursing course, radiography, nutrition and dietetics, but you need to drive an hour south around the coast to get to midwives, physiotherapy, occupational therapy, paramedicine, or you have to drive into the city for an hour to get to pharmacy. So that has implications for what interprofessional looks like because not everybody's in the same place. In terms of staffing, that's my job in the middle. So my job is interprofessional curriculum across the 12 health professions. And we have a dedicated staff member in medicine, but through all the other professions, there's just an academic that has that portfolio. So say from nursing and midwifery, there's an academic in that department that has the interprofessional portfolio. And this is really important because it needs what we call collaborative leadership. So this work is being done by a range of academics working together. I can't go further without kicking off with some definitions. So the end game, the point of this is interprofessional collaborative practice. So ultimately, we want all our health professions working together for patients, families, carers and communities. The way, or one of the ways to get there, is formal interprofessional education. So this is bringing members or students of 2 or more professions together to learn about, with and from, in order to improve collaboration and quality of care. But also a broader term to understand, and I'll come back to that, is interprofessional learning. So that is arising from interaction between students and other health professions. And some of that can be learned uniprofessionally. So learning what a dietitian does, you don't necessarily need to have students coming together for that. And a lot of the learning that occurs in our hospitals, in the workplace, isn't that formal IPE, but it's still interacting and talking with and learning from others. So interprofessional learning is the whole spectrum, and interprofessional education is the structured activities that we deliver and you will deliver. Just a quick moment on why. So this isn't new. This has been around for quite a while. 60s and the 70s, and it's really came out of errors where the team wasn't working together effectively. Errors happen to patients, and the whole quality and safety movement has come. We've understood that if everybody's working together, less likely to have errors occur. But more recently, and certainly with COVID, interprofessional education or teams working together is so important for the workforce. There's so much burnout, and the workplace is stressful and difficult, and there is a lot of work. So that idea that we need to work better together to maintain our health workforce. There's drivers around resources and costs. We don't need 2 people doing the same thing. There's enough work to do without duplicating. So understanding who's doing what and who and how that can be best done. There's increasing understanding all the social contributions to health, so linking social care with medical care. And certainly in Australia and elsewhere, there's now curriculum and accreditation requirements. So your courses in Australia, a medical and nursing course, couldn't go ahead if it didn't have interprofessional education in it. So lots of sort of drivers for this curriculum. But what it is not, so reassurance to the people that are concerned, it is not about doing someone else's job. It's not about losing your professional identity. It's not about loss of power or presence, etc. So because we're a big university and we didn't want a whole lot of people trying to do this individually, we established an interprofessional learning framework. And I'm going to talk for the next half an hour about all we've done, but I want to reassure you, that it's taken years to get here. So in 2016, we formed a committee, a working group to establish a framework and put things in place. And that had students on it and it had patients on it. So we looked at interprofessional frameworks and made a real plan for what our university was going to do. By 2017, we established a curriculum framework, and I'll talk in a moment about that. By 2018, we started to build lots of programs. The first one, medicine and pharmacy together, then nursing and medicine together, etc. Then by 2019, we were looking at not just what was happening at university, but how we put more things in the workplace. So in the hospital, in the communities, in the clinics, because IPE shouldn't just be happening at university, it should happen throughout the courses. And then in 2020 and 2021, we changed everything to film things and have online things like everybody else through COVID. And this year we've looked at an evaluation to understand how have we gone with, has this framework done anything? By sort of interviewing our grads that are now out there and interviewing their employers to ask them, what are our students like as team players? So I wanted to, and I'm sure you will want to, take an existing interprofessional framework and say, what is it that I need to teach? So Canada's got a fantastic national competency framework. It has a clear list of 6 domains of learning outcomes to be a collaborative practitioner. There's an American one called Competencies. In Australia, there was a statement, and in Perth, there's a fantastic interprofessional framework. But when we tried to apply that framework to our context, it didn't quite work. And there were a few reasons. So, for example, the Canadian interprofessional framework looks at not just undergraduate, but the whole domain of practice. So it's got learning outcomes expected of experienced practitioners, like managing conflict and leadership and whatnot. So that was too hard for all of our learners. And some of the language wasn't right from the American one. So what we ended up doing was we looked at the 12 health professions that we had, and we looked at the accreditation items and came up with our own framework, which we called a collaborative care curriculum framework. And essentially there's 4 themes to the framework. So in other words, there's 4 main themes that a student from any health profession that goes through our university should, by graduation, be competent in. So the first is the concept of person-centered care. So rather than having a medical lens or a nursing lens or a pharmacy lens, the idea that the patient or the person is always the centre, and we will work around that. And there's a list of learning outcomes about that. The second is role understanding. So the idea, you need to actually know what other people do, to know when to refer to them. You need to have the skills of referral processes. The third is interprofessional communication. So the skills of being able to and confidently to talk to the other colleagues in the healthcare setting. So simple things like picking up the phone, written communication, but also harder things. So when you disagree with a colleague, the language and the confidence to address that. And the fourth theme is collaboration within and across teams. So that's not just the local, so an emergency team or a surgical team, it's how you communicate primary care, secondary care, how we do all those different communication modalities and how they look different with an electronic medical record versus face-to-face, etc. So there's an article about that, but essentially where you get to is a single 1-page document which has a list of learning outcomes, and we all agreed, our 12, believe it or not, after a fair bit of debate, 12 health professions, we agreed on the language at 3 different levels. And the levels we decided, the novice level is what you would know in the first year of your course. So it's really a knowledge domain. What does a pharmacist do? What are the principles of teamwork? If you look at the intermediate level, it's lots of things you would do in a simulation. So being able to apply things. So know the difference between a physiotherapist and an occupational therapist. And then the entry to practice level was putting into practice. So a lot of that happens in the workplace. So you can see what the learning content looks like in the early years, which is knowledge and whatnot, looks quite different to what it looks like later on. and lots of education folk in the audience here. So you will know once you've decided your learning outcomes, you just need the learning activities to align with that, and you need the assessment to align with that. So everything gets built along the same, with logic really. And also reminding, for those that don't know, when you look at how competent someone is, there's this whole hierarchy. So there's knowledge things first of all, you need to know basic content, then you need to apply it, and eventually, as a graduate, you should be doing it. So curriculum and assessment looks different at different levels. I'll talk briefly around our programs. So if you think about the novice, intermediate and entry to practice, if you're at Monash University student, these are the sorts of activities you would do. So at the novice level, everybody does these mandatory online modules. So you go through understanding what the roles of different professions do, what's principles of teamwork, what is interprofessional communication, what is closed loop communication, etc. And the physios and OTs will come together for a day. If you're in any of these courses, so if you're medicine, dietetics or radiography, you'd be doing a whole day of breast cancer together. So they look at the journey and who does what. If you're in medicine or pharmacy, you do have an afternoon session on asthma together. If you're in nursing or pharmacy, you would do cardiovascular disease together. And then in your latter years, there's all our health professions. So 10 of them do an anti-racism series of modules where they all come together over Zoom. The medicine, nursing and pharmacy would do a medication safety workshop, and I'll talk about that. The medicine and nursing students spend a whole day together on some content, delirium, managing difficult communication, and the medicine and midwifery students will do some simulations together. In addition to that, there's loads of optional things. So students that are keen can opt into sometimes international exchange in the era where we used to do that. It's now virtual, but there's other clinics and whatnot. So the framework sort of mandated that all students had some basic foundational skills, some simulated practice, and some experience in the workplace later. Novice modules look pretty simple. So they're really just half an hour. One of them's on interprofessional communication, one of them's on role understanding. And if I've got time, I'll come back and flick through some of these modules. But essentially the same content goes to all our health professions. So we're sending the same messages. By the time our different students get together, they're not saying, I don't really know what a pharmacist does, or what sort of roles is a nurse doing? They're all the basic stuff they're meant to learn before we bring them together. And here's a little detail, I guess, about some of the actual activities. So the year 2 medicine and pharmacy, I said they do asthma together. And there's actually a video on YouTube of this day, which I can give you the link to. I probably should also say Monash University has a campus both here and in Malaysia. So Malaysian medicine and pharmacy students on the same day as we do it in Clayton will run that activity, which is that picture in the bottom left. So there's always content they do before they come together, which is, watch the video, understand the case, do some preparation. And then when they come together, the curriculum is always about something they need to do together. So in this case, it's write an asthma management plan. So the pharmacists come in with a clear idea on what they think this patient should need, and the doctors come in with a clear idea. And it's all about, they literally have to work together to get agreement and justify, well, why would you be proposing this versus that for the patient? So the curriculum is always about working together more than it's actually about asthma. So the true asthma learning, or the science of asthma learning, still happens separately, but the collaboration is how do you get on the same page. It's really worth saying that we set up curriculum on those learning outcomes, and one of the things in this case is we make it quite bad so that the right thing to do would be for the pharmacist to pick up the phone and ring the GP because there's a problem. And we ran this curriculum for a few years, and students were constantly saying, I'd never ring the doctor. And the doctors are saying, well, I'd never ring the pharmacist. So the idea, well, the doctor's too busy, so I'm not going to ring. Or the pharmacist's too busy in the clinic, so I'm not going to ring them. So we had to do things like film what this conversation looks like to actually model, give people confidence that, oh no, absolutely, there's circumstances where you are going to need to get on the phone, and this is what this conversation looks like. So I think it's been interesting watching what sort of curriculum is needed. There's no point saying you just need to pick up the phone and ring somebody in an era where we do a lot of texting, we do a lot of messaging, and confidence to ring someone you don't know is something that needs to be explicitly taught. Nursing and pharmacy, an example where we take chest pain, and essentially once again, there's a situation where they get content to look at beforehand, and then when they come together, the first task is to understand, well, who are all the different professions that someone that has chest pain sees, and they sort of brainstorm everything from the paramedic to the emergency department to whatnot. And then they get a task where there's a problem with blood pressure, or there's something that they need to resolve, and they need to once again come up with a plan. And in this one, they practice using ISBAR, so that structured communication to their colleagues. We make things harder again. So things like the patient wants to go home, the patient saying, all the different people tell me different things. One person told me to take my statin after breakfast. Another person said to take it in the evening. Who's right? Is the nurse right, or is the pharmacist right? And the idea of the students come together, and we just ask them, what do you do? What do you do in a circumstance where there's mixed messages? Because it's acknowledging that this is the reality of practice. It is messy, and you need to talk to one another to make the message clear. In the final year, so the doctors and nurses spend a whole day together. Once again, it's literally things like they swap telephone numbers, doctors and nurses, and we give them information. They've got to pick up the phone and dial their colleagues with a handover. And students find this difficult initially to say, oh, I'm too scared to ring. But by the end, hopefully, when they have to go do those first phone calls on the hospital wards, when I first have to ring the doctor or the nurse with a problem, they've had some practice at it. So that's something we work on. Another thing where we make it pretty tricky is through simulation. So we use Delirium as part of that content. So the students, we don't tell them what's going to occur, and they literally enter the room, and this fantastic simulated actor is all confused and trying to climb out of the bed, and the nursing and medical students have to work together. And what works really well in this curriculum is basically the nurses need the doctors to put some plans in place, and the doctors need the nurses to understand some of the management strategies and what's gone on. So the curriculum, hopefully by the end of that day, is everybody leaves thinking, I would definitely speak to the nurse, or I would definitely speak to the doctor, sort of thing. Other activities, things like a wound, they work together to understand a wound and then present that back to the broader group. And we also do strategic things like lunch together in small groups, because a lot of this learning occurs through dialogue. So as much as the curriculum is incredibly important, scheduling some time for dialogue so that some of the informal things are also spoken about is really important. The end of the day with our final year medicine and nursing students, we really facilitate reflection. How did it feel working with other professions? What would you like to do differently? What are you going to do when you're in the hospital and you don't know who to speak to? Because we sort of set this up to be just a period of growth. It's not like one dose of IPE suddenly enlist everybody to be confident in working with the team, but it's the idea of this is a long process, and each time you work with a team, you should get more skills in that space. Another terrific piece of curriculum which we've put in our hospitals, it's medication safety. We actually just published this paper so you can look in detail, but essentially students are already in our hospital and they are sent to a workshop around medication safety. It just goes for 2 hours. There's about 24 students at a time, and they rotate through stations. So things like we just give them a bag of messed up medications, and the medicine, nursing and pharmacy students have to make sense of which of these medications, what's out of date, what's the problem, why are they on one thing instead of another. One is a pop quiz, so they see how many items they know and do some drug calculations, etc. And then they all come together to present back. So it's a little bit of fun, a little bit of socialization, but also actual, we take common problems from the clinical setting and work on those. There's some photos you might be able to see. So the mixed bag, the top left corner, where they're trying to work out the medications, and similarly trying to do the case study further down, that second image. The next thing I really wanted to touch on is this idea of formal and informal learning. So at the moment, I've spoken very much around the formal curriculum. So it's something that an educator, that I or you will design, and you deliver it, and it hopefully aligns with the learning outcomes. In the interprofessional space, absolutely that's key, but also we're really starting to use more the informal. So what can be learned in the workplace, because we know the team meeting or the conversations in the corridor where a whole lot of learning occurs as well. So we can strategically use some of those things in the curriculum. So things like in this activity that we wrote about, we essentially sent students on their placement. You need to go and find someone in the hospital that you don't know what their role is, to observe a part of their task. So observe a wound assessment, observe a falls assessment, look at an OT home visit, and talk to that clinician and then reflect back. So the true IPE of putting students together in groups is slightly different to this. This is very much saying the hospital is full of lots of workers. There's great opportunities. What could you maximise, or what could you write into the curriculum that requires you to go and do some learning? And we found the team meeting, for example, is a fantastic site of learning. So by sitting in on a team meeting and then reflecting on who was sitting around the table, what was the perspective of the different roles? Were there any overlaps? There's lots of learning for that entry to practice level that can occur in our hospitals and in our workplaces. I said I'll speak for a minute about what happened with COVID, because we had all these fantastic programs and many of them changed. This is our logo in Melbourne. We had stay home, stay safe, save lives, and pretty much like everywhere else in the world, lots of learning was online and our students couldn't come together. So the idea of interprofessional education bringing people together and COVID needing to keep people apart was a fair challenge. So things like the medicine pharmacy workshop became an interactive Zoom with lots of breakout rooms. So the students that would have been sitting around a table were put into individual breakout rooms to do that. Things like the midwifery and medical student workshop with skills, we just had the clinicians in their PPE. We filmed the work and the students once again were interactive on Zoom to talk about the teamwork attributes. The cancer piece, normally our breast cancer survivor would come in and the students were in groups. We filmed a lot of this, and to be honest, that's a piece of curriculum that worked better online. So even though we will be able to we have returned to some face-to-face learning, some things where we could capture, for example, some terrific patient stories, that will possibly stay online. The Delirium Simulation, we filmed once again, and the students that would, as I said, normally they would be ringing each other, etc. in that interprofessional learning day. We still via Zoom, we've got the medical and nursing students just swap their mobile numbers. They went away and practiced. We gave them the clinical content so they could still have that same experience of, I had to ring the doctor or I had to ring the nurse to gain some confidence in that space. What I did learn, and I guess my advice moving forward, is building some terrific interprofessional resources is really useful. So now we've filmed, so the filming on the left there is a long case we've filmed, which is medicine, nursing and pharmacist there when a patient's been admitted. So we film it all, but we film those conversations in the corridor, sort of modelling. This is what it's like when everyone's a bit confused. We're all talking about, what do you think is going on? What's your perspective from the emergency nurse, the doctor, etc. And the other filming to the right there is the paramedic handing over to the nurse and to the pharmacist. So we can use the filmed resources, and then we bring the students together to talk about what the roles were of the different professions. So high quality, well scripted, good resources are a great education tool. I think there's something in the chat there.
Excuse me, Prof. Ken.
Hi.
Hi. Yeah, it's fascinating presentation, and I would like to say 10 minutes left from now. For
Yes.
Your plan. Okay.
Yes, I will get there. We've got 10 minutes
Thank
to
you.
talk identity, which I think is really important. Thank you.
Thank you.
So professional identity, you'll probably be aware of the idea of we develop a sense of self, like I belong to, I am a doctor, a nurse, through the acquisition of beliefs, values, behaviours. And that's influenced by lots of things, by media, society, before our students even start their course. A uniprofessional identity is strong favoritism towards one profession, your own profession, while developing prejudice or bias. And this is sort of natural. We build up our own group by putting down the others. So by having all the nurses, medicine bonding together, we can almost, it can be a positive feeling in our group because we feel like we belong. But what we're really trying to do with interprofessional work is establish dual identity. So you can absolutely feel like you are the doctor, the nurse, the pharmacist, but you also feel like, but I'm a member of the emergency team, or I'm a member of the rheumatology team. So that idea that you can have the identity of being a team person, but also being your individual profession is what we're aspiring to do. And I'm sure you can all think of so many stereotypes, assumptions, biases that we have. And I think it's really important that we, as educators, think about, before we even start teaching, those assumptions and biases we have. Things like I can never read doctors' handwriting, or the nurses are always rushed. These ideas and stereotypes that we might say and believe in, that we need to make sure we're not continuing that in our teaching. And really looking, sorry, hello. I know. And looking at where there's all the areas of overlap. In terms of facilitating interprofessional work, the message is you need to co-facilitate. So if we just had doctors and nurses together and always the doctors were facilitating, that's not modelling the idea that we really need one another. So the competencies really for being a good interprofessional facilitator is commitment, the role modelling, the understanding of group dynamics, etc. But there's a great, once again, there's a book chapter we've written, which I've just summarised here. But my tips, if you have to be facilitating an interprofessional group, before you start, you need to know the backgrounds of others. Lots of things about creating a safe environment so that one profession doesn't feel safe in this space and one is reluctant to engage. Really understanding hierarchy and valuing the roles of different professions. And sometimes it's about pointing it out. So if there's a case where they're saying, well, I don't know what my job would be here, as a facilitator to say, well, surely as a nurse in this setting, you know the backup, you know the story, and you would communicate that. So sometimes it's about drawing the expertise into the group where someone might not recognise it. Certainly self-awareness as a facilitator, and really to reflect each time I teach interprofessional groups, I stop to think, how did that work for each of the people participating? And the other thing, I think if there's one main thing to be a really good facilitator, it's getting the questions right. So asking good probing questions. What is the difference between the way a pharmacist and a doctor would take a medication history for the students to unpack, well, you know, here are the things I would do. So good questions, and really leaning in where there's differences of opinion to engage in that conversation. In terms of evaluating programs, it's really important. Well, what we've taken is a whole of curriculum approach. So rather than looking at how good one specific program is, essentially I want to know at the end when they graduate, what are they like? So what we've been doing is interviewing our grads or interviewing the employers of our graduates to understand how are they performing in teamwork. But also we've collected information around the staffing, the process, to understand how much of that curriculum framework ended up inside curriculum now that we're a few years down. The feedback's been incredibly positive. So students really, number one, they enjoy it, but also there are lots of comments around, I understand what the other person does now. This longer quote here, I feel more informed and confident about liaising with other professions, communication for better patient outcomes. And really, I guess one of the things, an outcome we want is we want the students to keep asking questions. If there's someone in the ward, if there's someone looking after your patient, you don't know what their role is or what their contribution is, to start to ask the question. And we're delighted that many of our employers are saying that our graduates, you can see this quote here, I think the preparedness for interns is better now than it was 5-10 years ago, for certain, particularly to deal with a lot of the non-clinical knowledge of being doctors, coordinating, liaising with teams, communication skills. So we're delighted that that's an outcome that some of our employers are saying. So lots of talking, but in summary, really to think about our context has very much dictated what our curriculum is. So I think absolutely, I'm not advocating that to do what we've done, but to think about what your context needs and what that framework and implementation looks like. I think you need a framework. What framework you use is really up to you. Around, you can see the reasons we chose our framework. There's many frameworks, but to think about a logical framework, which is a good blueprint for everyone to come back to. And then you're not asking what are the learning outcomes of this session, because they've already been established. I've spoken about some of our programs. I can talk about more, and some of our innovations. I really want to emphasize this, that point of this is about identity, that we can be both a single profession and be a member of the team. So it's not about diminishing identity, it's about developing a collaborative identity, and really just touched on facilitator skills and evaluation. I did also want to say, this is my whole life's work. I'm very happy to, if anyone wants particular detail on any of this work, I'm really happy for you to shoot me an email, and I'm happy to talk more about any of that content. Similarly, there's a load of resources. There's, and I can direct you to some websites where we're starting to share resources as well, where curriculum is already being developed, so you don't have to start from scratch. And that's it. I'm going to stop talking for a moment. So thank you very much for bearing with a lot of chat.
Yeah. Thank you, Professor Ken, for the really exquisite presentation. It's really interesting for us to learn, and a lot of programs that we can share in here. But let me rewind to front of the presentation. Perhaps some audience already missed some information. And who is this our first speakers, because I missed in the beginning. So let me introduce you again, Professor Ken, for the audience. And please, the team of the IPE, share the CV of Professor Ken. Yeah, so Professor Fiona Ken from Monash University, Australia, doing her both master's and PhD in Monash University, and the current role right now is an associate professor NHS Monash University as a director of collaborative care and work integrated learning. And also a lot of grants and a lot of yeah,
A lot of writing.
articles that you can easily find online in any Google Scholar, PubMed, and any other academic website. And this is really, really important for us to learn, because we are here, want to share the knowledge and also take some contact from Monash University to UNS University. Thank you very much, Professor Fiona Ken, for your presentation. And for the Q&A session, we will hold for a minute because our second speaker is already there. Dr. Boy, hi, how are you?
Hi, I'm fine.
Yeah, thank you. Here, the CV of Dr. Boy. Perhaps some of the audience already know who is he. Yeah, so Dr. Boy is a lecturer in medical faculty of UNS and also finished his master in Gajah Mada University, and right now currently he's doing the residency of physical medicine and rehabilitation on University of Airlangga. Okay, without further ado, I will ask Dr. Boy to present his material for practical and experience of implementing IPE learning. Please, Dr. Boy, the screen is yours.
Okay, thank you, Dr. Widana, for kind of the introductions, and good afternoon, everybody. I would like to say thank you for this very great opportunity for me to share. I believe I am not the smarter than you. I believe that you are not only a student, but also there are some of the field supervisor and also some colleague outside from Universitas 11 Maret. I believe that all of you already know about the interprofessional education and collaborative practice. So in this afternoon, I just want to share what is the lesson learned from our institution to conduct the IPE learning. So maybe I want to share my screen. So my topic today is about the practical and experience of the implementing IPE learning in the context of Faculty of Medicine Universitas 11 Maret. So this is the outline of my presentations. First, I want to share to you about the current IPE and the approach of IPE, especially in Indonesia. And the second is I want to share to you a lesson learned about the implementing from the planning until to the evaluation of the IPE in the Faculty of Medicine UNS. And also I want to challenge all of you what kind of the current IPE conditions that become the recent challenge for us as a faculty member or as students or as a supervisor in field. What is the challenge for us? And lastly, and I want to make homework for us. What is the future homework to make the educations, to make the collaborative learning should be done more grateful in the future? So first, I want to remember to you about why we need IPE in our curricula. Like I said that there are two of the main factors: educational context and also the health services. For the educational context, is influenced by from the institutional policy, from the students, from the what we have in the institutional context, and what we done in our curriculum. So why we need IPE based on the education is we need to exposure more about the idea to develop the best of curriculum designs. Sorry. And also we make the opportunity to work with the different people, because if we think that we have another perspective to designing, to implementing the educations, maybe our curriculum design more grateful. And then the third is increase the cultural sensitivity, because I know the health professional education is more tricky, more cultural context, and more somehow is more sensitive about the not only about the disease, not only about the what is our role into the patient, what is our role into the healthcare system, and also about the maybe financial or economical issues, and also enhance the flexibility in working with the students, because the students right now is the millennial students, so they more desire and more belonging to collaborative with not only from the medical or one of the health contexts, maybe they need more collaborate with the others disciplines. And then we must consider to improve the sense of cooperations and networking between departments, maybe not only department, networking with the other institutions, and also impetus to discover more community resources. That is the educational context. But we know that the IPE is the basic for the future is how, improving the health care quality. So we must consider about the health services. Burden of disease, healthcare system, and reduction of the communication within the healthcare is the biggest problem, that biggest issue, that why the IPE should be done in the undergraduate until continuing the professional development context. So this is the issue why we need the IPE. And also by the IPE, we perhaps that can increase the morale and the efficiency of the caring the patient, caring the community, and also avoidance of the unhelpful protectionism. But maybe 2 or 3 past years that why we need IPE is this situation, accreditations, because many health program that in the accreditations document should mention about, is there any collaborative learning, is there any interprofessional learning, or is there any other opportunity for the student to get the other perspective, or to get the other science and the other subject with chance to collaborate with the other student from the other health professional programs. So we think this kind of the factor should be answered if we want to start the IPE. Before I going through the interprofessional context, I need to refresh all of you about the difference uniprofessional and interprofessional. We need to determine those kind of learning. Actually, for environmental learning of uni or interprofessional educations, various setting is same. Like we need to lecture tutors, we need a classroom, we need clinical setting, and also some of the conversation about the educational context. But the difference become from the team dynamic until the assessment. From the team dynamic that we know in the interprofessional context, miscommunication can be done in the collaborative or in the teamwork, because communication can be positive and also can be negative. Maybe the possible, most possible why the miscommunication can be done in the interprofessional team, because the hierarchy issues. Yeah, like I said, in the Eastern culture, like in Indonesia, doctor have the higher level or higher hierarchy of the team, healthcare team. So it is it probably the possibility of the miscommunication between the other professional, maybe nursing or the dietitian or maybe physiotherapist, difficult to communicate properly to the doctors. This is the main issue. And also from the group, according to the interprofessional definitions, show that the group of the interprofessional team should be consist 2 or more about the health professional students, maybe from the medical doctor, midwife, and also nursing, and etc. And for all of you who are the faculty member, you are responsible to be the facilitator. If you are a facilitator in the interprofessional context, you should represent various disciplines of the student being taught. This is very effortful, I think, because I am a medical doctor. If I, as a facilitator in the IPE team, which consists of the medical doctor, midwife, or maybe nursing, so I should have represent about what nurse should be done, what midwife should be done in the context of caring the patients. So I think, very effortful. And also about the activity design, most of the interprofessional learning should be done in the group base, but uniprofessional maybe can be assessed by individual or group activities. It impacts to the assessment process in the interprofessional learning, because in the interprofessional learning, we not assess about the science about the subject that the student learn, maybe about the OBGYN or about the internal medicine. The internal medicine is the bridge for the student to collaborate. But the assessing the interprofessional is what what the students can be gaining the competencies of the interprofessional competencies, such as communication, collaboration, teamwork. They know their role and their responsibility, and they know how to communicate with the others. So that is the assessing of the interprofessional level. So moving on to current situation of the IPE, maybe we can start from the student readiness. I believe many of you in this webinar conduct several research talking about the IPE, from the perception, from the designing until the evaluation of the IPE. But like I said in this publication by Chad in the 2017, showed us that the IPE can be improving the competencies of collaboration, such as teamwork and also the professional identity. And the other perspective that about talking about the student readiness is student influenced by the others to collaborate, such as student by overtime in professional identity and readiness for interprofessional learning need to be changed. And also influenced by the student characteristic, because the student right now is millennial era, so they not can be done by themselves, but they need collaborate with the others. And then also influenced by professional program, which is healthcare system, and also influenced by interprofessional education, and of course influenced by contact with the others. And moving on to the Indonesian student perception, I cite several journals that already done. Maybe all of you, one of you, I mentioned in this journal. Indonesian student perception and readiness mostly are positive for implementing the IP, means that most of the student, health professional student in Indonesia has a good desire, has a good belonging to become the part of the IPE team. But the student of Indonesia still have a stereotype among the health professionals still exists. And those stereotypes from two multifactorial process, such as, like I mentioned before, like a medical doctor, maybe the higher hierarchy of the healthcare team, or maybe another factor that becoming the stereotype among the healthcare students. And also early exposure to clinical practice trigger both positive and negative perception of the IPE in students. If the student early exposure about the collaboration until they practice the collaboration in the workplace or in the clinical setting, they can be triggered more and maybe gaining more about the competencies of the collaborative. And also in the IPA context, role model is the main, or maybe like I said, is most important thing that student need, because a student wanna see, oh, those doctor or those faculty member have a good role model to collaborate. So I want to be like them, or I want to be like her as a role model of the collaborative learning. So I think the strong model of a strong role model from the various health profession is needed. And talking about the institutional context, the faculty development, I think, is the key of the successful IPE curricula. We must make a mindset of the collaborative learning through the all faculty member. If the faculty member have a good mindset of the collaborative learning, any kind of design of the IPE is easy to running in our curricula. And also, I believe in Indonesian culture need to have a champion for kind of project, champion of kind of learning, or champion of kind of curriculum, because this champion should have a role to make from the planning, actions, evaluations are running smoothly. So the champion should have in each institution, IPE champions. And also because the IPE is conducted by several health programs, which is maybe more than 2 health study programs. So we must establish a coordination between health care program. And also about the setting, I will talk later about proper educational setting. Another big issue of the IPE learning is academic skill and also financial issue. I know that maybe most of us, the health student or health study program, not only in one faculty, maybe 2 or 3 faculties. So to merge the academic schedule is very, very effortful. So this is still need to get the faculty development as well as the stakeholder power. And also about the collaborative assessment, like I mentioned before, the assessment of the IPE is different from the uni-professional educations. So this is the common setting that already done in Indonesia. May I say that community-based education is the most common, the most proper, the most ready, and the most implementable in Indonesia. Why? I think the community-based is very related with the healthcare system in Indonesia, because we must more power or more have a good foundation in the primary health setting. So the community-based education is the most common IPE setting in Indonesia. But I believe that several institutions conduct hospital-based, because the hospital-based is more transformed from the IPE into the IPE IPC and practice, but still more a challenge how we conduct in the hospital setting, because what kind of department that we need to be collaborate, and what kind of the setting in the hospital need to collaborate, maybe emergency or intensive care or the others. And also the classroom setting is the most common also, but for the basic implementation, but also the classroom is most common during this pandemic era, because in the pandemic era, the student cannot in touch with the community directly. So the classroom make the alternative way for hybrid or combined interprofessional learning. If you remember the framework of WHO talking about the interprofessional educations, that the IPE is the basic to the IPC, and then improving the hardcore quality. So we must consider about the learning continuum interprofessional educations. Right now, if you are the faculty member of the undergraduate, the interprofessional education just as a basic principle and the basic of action of the collaboration. We should consider that after they graduate from the undergraduate level, the student need to be more interprofessional context in the clinical setting or in the workforce workplace learning. After that, after the student graduate from the clinical or the workplace, they will be more need to collaborate, more need to become healthcare team in the context of professional development. So this is the learning continuum that we need to consider about designing IPE curricula. Through the learning continuum, also we must make the learning outcome from the reaction to the performance in practice. So this is our homework for how we conduct the learning outcome of IPE from reaction to the performance. And the other factors is about the culture, about the policy, about the system, about the setting of the IPE is more considered. So I'm moving forward to the lesson learned from our institutions, how we conduct the IPE until right now. In Indonesia, we have two important documents. There is curriculum framework of the IPE and the academic letter of the IPE. This document is very helpful for us to start the IPE if your institution or if your faculty didn't start the IPE yet. So maybe you can read more about the curriculum framework and academic letter from the IPE consortium in Indonesia. The other side, maybe you can also read about the WHO guideline, another framework from CAPE, another framework from Canada, another framework from Australia as well, and many more. So this is the milestone that we must read more about the IPE curriculum. Talking about our institution, which is my Faculty of Medicine UNS, starting the IPE by initial project, we start several research from student and faculty perspective, what kind of they want to know about the collaboration, what they want to learn about the interprofessional learning through the curriculum context. So we conduct the research about the student and the faculty perspective. And also we conduct the research about how we design the learning of the IPE. Before we mention the IPE into the curriculum, we designing first and we make a piloting first. And also we not only about the designing, we also make piloting about the assessment. What kind of the proper assessment for us, which is our institution, suitable for our characteristic of students. And also we conduct several benchmarking and collaboration with the other institutions to have another view of implementing IPE in the curriculum. The initial product of our research is this framework, which consists of 3 phases: socializations, implementations, and evaluations. For the implementation, we implement the IPE into the community-based educations, consists of 7 steps. Community stakeholder identification, that the student should identify what kind of the stakeholder in the community that they want to more learn about the healthcare system and healthcare provider in the community. And then community approach, we conduct family as partner. And also community need assessment, we assess community by several tools. After they know about the problem in the community, the student need to be plan what kind of the project that's suitable for this community. And then also the student need to prioritize about and also focusing the project that should be done in this community, and then implementation and reflection. The 3rd phase is evaluations. Due to the learning continuum that I already mentioned before, we consider what kind of elaboration this framework, those 3 phases. By considering the learning continuum, we conduct the IPE from the 1st year until the 3rd year of curriculum. In the 1st year, we just exposure the student about the IPE in the context of cognitions and knowledge about collaborative and healthcare team. In the 2nd year is transitions from the cognitive level and knowledge level into the skill and behavior about the collaborative learning. And 3rd year, perhaps the student can actions about the interprofessional learning into the community. This kind of process impacted to the level of competency that should be embedded to the students from no until yes. So this hierarchy also impacted to the performance assessment. Based on this pyramid, so we separate and elaborate the 3 phases into 3 years academic. First is socialization. We conduct into the 1st year, which is early exposure of the IPE, and the 2nd until 3rd phases is conduct into 2nd and 3rd years, from immersion to mastery. So this is the prior collaborative learning outcome in our institutions. From the 1st year, we just want to student know about the ethic and professionalism, about their professional identity as a healthcare provider, role and responsibility within the health team, and also to know the basic knowledge of the collaborations. We conduct it into the course, like maybe you can say like a modules or a learning course. We give the title of course is Basic Medical Doctor and Health Professional for medical program, but from the other study program, adjustable by their curriculum. And the 2nd year is we make the learning objective to develop the collaboration skills, which consists of team management, managing conflict within health collaborations, develop the basic implementation of team and collaborations within the community medicine through the prevention and promotion medicines. And then we try to conduct semi-interprofessional about the managing data and community problem through the health intervention program. We give this learning objective into the course with the title is Research Methodology in the Community Base, like a surveillance, epidemiology, basic mass communication, and project management. So the student will be collaborate with the puskesmas or primary healthcare to conduct collecting data and to conduct the surveillance due to the primary healthcare data. And the third year is do the community health project in the context of family as partner. We give the title of the course is Community Health Project Interprofessional Education. This third year is the real interprofessional education in our institutions. So this is the characteristic of each years, that the first years is uni-professional, but the lecturer is multi-professional faculty. So we give knowledge about what the nurse, what the midwife is, what is the doctors, and what is the healthcare team by lecturing. And the second years, we conduct the project by surveillance and epidemiological, and they supervised by field instructor. I see that some of the field instructor attend this webinar. Thank you for your supervising our students, and also the faculty member as a mentor. And the third years is fully interprofessional because they will be consist of the medical, midwifery, pharmacy, and they will be a team for 12 weeks. They will be conduct the project based on the family problem and the community problem based on those 7 steps that I already mentioned before. The competency and the assessment in our IPE, we modified from the IPEC framework 2016. We will assess the 4 domain, I mean the 4 core competencies, which is value and ethics, role and responsibility, communication, and teamwork. But we also assess the connection between the core competency, like faith, calling or communicating how they coordination with the others, safetyness, and healthcare quality. We conduct the multi-source assessment about the core competencies and the intermediate competencies. We conduct like a portfolio, reflections, and also because the pandemic era, we conduct the e-learning case-based discussions. And also we assess by the family as a partner. We assess how the family perception about the IPE team, what the student done in the family, what the student done in the community, and etc. And also we still conduct the multiple choice questions to assess the knowledge of the students. This is the evaluation year by year in our institutions. We still have a big homework for us to gaining or to improve the competency of ethic and value about the health identity, professional identity, I mean, and also about the communication skills. So this is our still challenge for us, how to conduct the learning within the communications soft skill, and also learning about the ethic and value through the collaborative learning.
Excuse me, Dr. Boy.
Yes.
Yeah, 10 minutes left for your presentation.
Okay, thank you. Maybe 10 minutes is enough. Okay, thank you, Dr. Widana. I continue. For the evaluation of the process of our IPE, we conduct the strength, weakness, we identify about the strength, weakness, opportunity, and the threat of the learning, such as our strength is we have the strategy program and we collaborate with more than 30 primary health center, and the opportunity is we are the part of health professional competency in the national level, and we have worldwide collaborations, and also we already mentioned the IPE into the accreditation level. But also we identify that our weakness is still lack of faculty development, because our mentor or our field supervisor still confused about how we should be facilitate the collaborative into the IPE team. And also we still don't have the IPE center like the other institutions, because the IPE center is more important for like I said, a financial issue or power for academic scheduling and etc. And also our weakness is the IPE is still embedded in the subject in our curriculum. Our threat is because the IPE, our setting is community-based education, but right now is pandemic situation. So this is our threat, how we conduct the IPE in the pandemic setting. And also academic scheduling still our issue, and also the financial issue, because 3 study program in UNS consists into 2 faculty of medicine and faculty of mathematics and science, which is pharmacists in there. So we consider about the financial issue. This kind of the evaluations need to be more analyzed to the what kind of the internal factor of our institution have, and what kind of the external factor that will be our threat or our weakness of the learning or our curriculum. So this is, I think, the design to evaluate the process of the IPE. And recent challenge to the IPE is I mentioned in the 3 domains: institutional, student, and facilitator, and the setting. Challenge for us is our curriculum, especially in Indonesia, is non-flexible. So if the IPE will be embedded in our curriculum, so we must consider is possible to how we said to embed it into micro curriculum or into the meso curriculum. And also because the curriculum is isolated education, so the student only learn about the educational context or educational subject in each study program. So if they outside of the study program, which is into the interprofessional collaboration and practice, maybe we need to consider about the prerequisite for the student before they going through the collaborations context. And also lack of organizational support. I believe that some of you maybe from the university or from the health institutions still need that the IPE didn't have any center or it didn't have any power in the university context or in the institutional context. So this is our challenge for us, how we get the support from the stakeholders. And also from the student and the facilitator is, yes, I honestly say that still have resistant to change, resistant to change about the method and learning activity in the IPE learning. And also hierarchy and centralism of the health professional background, and also objective measure of the IPE competencies still need to be more objectiveful and more comprehensive. And also the preparedness for the long term of the competencies, like IPE is just a basic before the student going to the practical and going to the professional providers. And also the setting, because the pandemic make us working from home, so the student need to be more engaged into the online learning. So this is the challenge for us, how the online learning can be done successfully for the IPE. And also readiness to the clinical setting, because the clinical setting is the transformation from the IPE into the professional providers. And also about the professional provider, if the student going to the maybe residency training or something else, how the student can be still got the collaborations or collaborative learning into the residency training. So this is our challenge. So facing up the challenge, you can read this journal because this journal is very informative and also very rich about how we conduct the IPE into the curriculum, from the structure and what kind of our role and what kind of our focus on the patients, or what kind of the method in the classroom, what kind of the facilitator that should be have in our learning or our faculty, and also what kind of the peer learning as a alternative way for the IPE learning, and also review and assessment. So you can read more about these tips and designing the IPE in this journal. So this is maybe the last slide from me. Starting from implementing IPE is the homework for us. Start for being and making the champions. So this is my homework for all of you. If you haven't done the IPE yet, so you must be a champion in your institutions. And also piloting for the project from the smaller unit. Assess the milestones that institutions have. You maybe have a big dream, but you back to the ground. You must assess the milestone that institutions have as the basic principle to implement the IPE in your institutions. And also make a survey for the student and the faculty member based on their perception, based on their view about the collaborative that they need into the curriculum. And also promote and publish your work, and also collaborate with the others, because curriculum was rigid, but you must embed IPE into it. Consider if you want to change the meso level, so you must collaborate with the others, communicate with the stakeholder, and coordination with the study program. I think that's enough. Thank you so much. We'll continue the discussion. Thank you, Dr. Widana.
Yeah, thank you, Dr. Boy, for a really useful presentation, and really good and practical for us in UNS, since we already know about that, but people around outside the UNS maybe need to look deeper into that IPE. And also we will open a Q&A session, and we already know there are several questions in chat box, and we would like to know what's the answer from the both speakers this afternoon. Can you please, the committee, to show us what's the questions? Yeah, even though I noticed as well, Professor Fiona already answered some of the questions on the chat box. Would you please to repeat again your answer to the several questions earlier, Prof. Fiona?
Yeah, sure. So
yeah, this is the first questions. I believe from Dr. Gilang, and he asked about this question. Thank you for your excellent topic, Prof. I am a dental public health lecturer. My question is, if there is a bunch of dental students joining the program, what kind of roles that we can give to them as a learning objective, regarding that dentists sometimes couldn't get in tune in several medical cases that run in IPE scenario? Please.
Yeah, thanks. This is a terrific question, and one of my PhD students is looking at effective IPE, and we know if the clinical context or the IPE is not authentic and relevant, then the outcomes aren't achieved. So you can't take a case and pop a few dental students in and expect that they'll get the right outcome. You need the clinical case that's relevant for dentistry to be involved. So sometimes that means if the dentistry students need some IPE, maybe the topic needs to be reviewed, or maybe it's a different piece of curriculum. So the question is, to whom does the dentistry students most need to communicate? And I probably don't know the answer to that, but to take the problem take where collaboration is needed and build curriculum on that, rather than taking IPE and dropping dentistry students in, because it's not logical and the outcome will be poor. So that's what I mean about, we can take curriculum frameworks from elsewhere, but it has to be in fitting with the students you need to educate and the context you've got. So a long answer, but basically it has to be authentic, and it should be driven from clinical practice. When and to whom do dentists most need to communicate? That's the topic for your IPE.
Okay, thank you for the answer. It's really practical, and hopefully Dr. Gilang satisfied with the answer. Can we
Okay, thank you.
Yes, thank you very much for your questions. Move to the next question, please. Okay, from Amir to Dr. Boy. The question is, what methods have you found effective in helping healthcare students in interprofessional education? Please, Dr. Boy.
Okay, thank you for the question from Amir. So the effective in helping healthcare students in the interprofessional education, I think there is no best method for interprofessional educations for the most effective or most powerful for the student to helping healthcare student, because the main concept of the helping healthcare student is teamwork. So if you done the teamwork by yourself, by your belief or your own method, and how you gaining the teamwork into the good team, I mean like good coordination, good communication, and good responsibility for value and professional identity. I think that is the most method for you to become the good team as helping for healthcare student. So several research said that maybe PBL or this skills laboratory or case-based discussions, or maybe community action project have a positive and negative way to conduct the IPE method as learning. But the several journals said that didn't have any the most effectiveness or the most efficient as a learning method, but they need to combine it, and they need to consider about the individuality, teamwork, and forming as a team for the helping healthcare student. I think the answer is like this.
Yes, thank you, Dr. Paul, for the answer. It's really clear, I hope, for Amir. And we jump to another question to save us some time, Okay, from Dr. Galuh to Prof. Fiona Ken, the question is, what's the biggest difficulty to arrange the educational topic of IPE in Monash University, and how to resolve it? Because in our faculty in UMY, Universitas Muhammadiyah Yogyakarta, we only have 4 majors of health sciences, and we found some difficulties to arrange topic for refreshing for majors to study and work together in collaboration in pre and clinical phase. Please, Prof. Fiona.
Dr. Gula, I feel your pain. So yes, it is very difficult, but it's doable. So initially when I started in this job, they said it's not possible, but it does need communication work. For me, it was medicine, pharmacy, nursing initially, but also the timetabling department, who said there's no way you can have 500 students in small breakout rooms. But to be really clear on what you need and why you need it and advocate, I did say in the chat that both in medicine and pharmacy initially, we decided on asthma only because when they said there's no lineup of curriculum, and I looked at it closely, I said, well, they're both doing respiratory in week 3. Can I take a snippet of respiratory content, asthma, and have 2 hours with the students together? So everyone said, yeah, it's true, they're doing asthma, we're doing asthma, let's do it together. But it needs, it needs some flexibility, and it needs relationships. If you don't have a relationship, if you're in the medical faculty and you don't really know anyone in the pharmacy faculty, it's very hard. So the relationships is the first thing. As staff members, you need to know one another, and then you'll be able to work together, and then it gets easier. And now I've got excellent colleagues in all the schools. So those, we call them portfolio holders, so leaders or champions, whatever you call them. Those people will consistently advocate, and people get used to it. It's just the first time is the hardest. But yes, relationships, and keep trying.
Yes, Dr. Galu, Prof. Fiona said, keep trying, don't give up, right?
Yeah.
Thank you, Prof.
Yes, thank you for the question, Dr. Galu, for sharing your experience, and we can learn from the experience as well here in UNS. Okay, next question from Siti Ma'rufa. The question is, in your opinion, what is an effective method of IPE and assessment in pre-clinical and clinical students? This is for Prof. Fiona. Please, Prof. Fiona.
So the rules of assessment apply as they do in all other areas of content. So is it knowledge that you're asking? Like what is teamwork? What does a pharmacist do? Then you can test that in a multiple choice quiz thing in the early years. Is it how they work together? As Dr. Boy was saying, they need to be looked at teams. It's a teamwork task, so you need to assess teams. And in the clinical setting, once again, it's in practice. So assessment looks different depending if it's early years, middle years, or latter years. And you probably shouldn't think of IPE assessment as different to any other assessment. So look at the learning outcome and say, what am I testing? Is it knowledge? Is it behavior? Is it skills? Is it reflection? And the assessment, therefore, aligns with that. So use your usual principles of assessment in health professional education and align the assessment. So once again, there's not a single answer to that. Just like interprofessional curriculum has lots of its stages, interprofessional assessment has lots of stages: knowledge, practice, attitudes, and performance in practice.
Yes, thank you, Prof. Fiona, for a really clear answer for Siti Ma'rufa. Is there any feedback? And if there are any feedback for any participants in here, you can write on your chat box or directly ask questions through the voice here. Okay. Next questions, please. Yeah, the questions here from Nathan Anthony. The question is for both speakers. Is it possible for medical students to learn IPC by themselves outside college curriculum? If it is possible, how can medical students improve their skills in IPC independently outside college curriculum? Thank you, Prof. Ken and Dr. Boy.
Dr. Boy, do you want to go first, or do you want me to go first?
I already answered this question into the chat box. I thank you, Nathan, for your questions. It's very, very possible if you want to learn about the collaborations outside the curriculum. May I say, like in the extra curriculum or student activities, like in Indonesia we call it UKM. Or unit kegiatan mahasiswa. So in those organization or student activity, you can learn about the collaborations, not only into the hard issue, but also how you gaining your professional identity as a team or as a medical doctor into the context of learning student activities. So you can also share your knowledge, share your perspective, share your point of view about something, about your current issues or your current situations. It's very, very possible to share about your thinking or in your brain and talk to the others, so the others will know about your kind of your identity and kind of your communications strategy with the others, and also about how you coordinate with the others. I think it's very, very possible. But remember that if you graduate from the medical school, you still need to be more learn about the collaboration, because you are as a professional provider, so you need to more collaborative with the others health professionals, such as nurse, midwife, or physiotherapist, or occupational therapist, and so on. So the collaborations learning can be done in along your life. I think like that. Fiona, maybe you want to add.
Yeah, I like answering this. It's like anything. Of course, if you want to learn something, a student wants to learn something, there's many ways you can engage with the world. You can speak, do you know anyone who is a physio, a social worker? Then you speak to them. I talk a lot about the hospital is such a rich learning environment. It's full of so many health professions, and you'll bump into them in the cafe and walking in and whatnot. So being curious and starting questions to say, hi, I'm a medical student, I'm a nursing student. I noticed you've got a paramedicine badge on. Tell me a little bit about that. Or did you just see my patient? Or, I noticed the dietitian just saw the patient to say, can you tell me a little bit about what you did with that patient? I'm about to see them. So we're doing a lot more of empowering students to absolutely, there's so much learning to be had. You need to go and look for it and make the most of it. The other thing that our very keen students do in Australia, I don't know if it applies for you, is lots of volunteer. So volunteering in aged care settings, in community settings, and then you get exposure to loads of psychology and social work and the nursing role and whatnot. So any volunteer in any healthcare setting, and you will just be immersed with the roles of many other professions. So absolutely, there's a lot that can be done. I like to say in addition to the curriculum rather than instead of the curriculum, but because I think the formal curriculum is really important, that everybody gets at least a baseline. But if you're keen, yes, there's so much more for our students to be able to do. And as educators, we need to empower them to do that rather than thinking we're going to give them all this we're going to give you the curriculum and the knowledge. It's more to be saying you've got the ability to get as much learning as you can when you're in the clinical settings.
Okay, that's the answer for the questions from Nathan and Anthony. And I remember perhaps our long time ago when I was still medical students, we watched kind of series in medical, like Disney series about doctor in ER or EMT or something like that. And it's really triggered us to think, oh, that's the field we will enter next couple years, something like that, right? So it kind of triggered us to think how we can collaborate, like on the movie, like so perfect, but in the real world it's not always like that, right? So it's good questions. Thank you, Nathan.
But there's also terrific biographies, and there's lots of written things from the perspective of the nurse, the pharmacist, the doctor, and even the patient's perspective of all those roles. So yeah, use the media, literature, movies, etc.
Yes, thank you very much. Okay, I believe there is still questions in the presentation from Amelia. Okay, this is for both of the speakers. The question is, I'm currently doing my research about faculty development in IPE in clinical setting. I would like to know about FD programs that have been conducted in Monash University and UNS to prepare the facilitator, and what's the challenges, especially in clinical setting. Thank you for very insightful presentation. Okay, go ahead.
So I'd like to start to say that when we started our curriculum in 2016, I ran lots of half-day sessions with so many staff. So Dr. Boyd's conversation about it's hard to get staff on board. I felt like I ran workshop and the workshops around this is what IPE is, this is what I want you to do. But now I don't do that very often. Generally before each IPE session, I have a facilitator guide, so a summary of here's the main content, here's the prompt questions, here's the learning outcomes. And we meet for 1 hour beforehand. So all the staff that are facilitating, we just do 1 hour together to make sure we're on the same page, and then it's fine. And what we also have is each year for each program, I've always got new people watching us do it. So the person that watches 1 year is ready to facilitate the next year. So just succession planning. Unfortunately, in the clinical setting, I've run very few. I've run some workshops for clinical staff, but the hospital staff are very, the timing, the allocation to education in the hospital is minimal. So sometimes an hour workshop and then not everybody attends. So it's hard in the clinical setting, but at the university, we're okay now. Dr. Boy, over to you.
I think we have the same pain, same condition, and same difficulty to conduct the faculty development. Yeah, thank you, Amalia, for the question. I think this question is related with the other institution, how we conduct the faculty development in order to gaining the faculty member through getting into the IPE learning. Yes, in our institution, Faculty of Medicine, UNS, still have the same problem. How we should done with the faculty member. We conduct several workshops about the how they will be good facilitator in the field condition or in the community, and also how they facilitate the IPE team and about the assessing the IPE and so on and so on. But again, the workshop just have a challenge for us how we making big change for the faculty member, because the faculty member have several resistance to change, several conditions that her or him believe is more powerful than the learning or curriculum context. So this is a challenge for us, how the faculty development is the key of successful of IPE. For the clinical setting, in our institutions conduct the clinic IPE in I mean IPC in the clinical setting, not all in department, maybe just 2 or 3 department, if I'm not mistaken. We conduct maybe I would say in the obstetrics and gynecology department, we conduct the IPE that the medical students will be in touch more with the midwife students about how they carrying the antenatal care or carrying the delivery processes and so on. And facilitator in those departments just make sure that this is the healthcare team, not healthcare students. So you must act like a professional, you must act like a provider for the patient, so the patient feel know as a rabbit for students, and also the facilitator make sure about the communication between the medical student and midwife done properly and not miscommunication. And also about the assessing, the medical student also assessed by the medical doctor, which is the specialist of the obstetrics and gynecologist, and also assessing by the midwife. So they will have two perspectives about their competence and their skills in context of the natal care. I think that's the answer.
Okay, thank you for the both speakers for answering the question from Amelia. Okay, for the other questions, perhaps any other audience would like to raise your hand to ask directly in here. And don't be shy, it's okay. Or you can write on the chat box. We still have around 10 minutes before we end the Q&A session. All right, if there is not yet any questions, so may I have questions? Because it's really interesting presentation and I enjoy it very much. And is it okay? I was okay, right?
Yes, please.
Yeah,
Please to
that's
Fiona, not to me.
all right. I heard about the excuse me on the background. I heard about the sustainable IPE in Prof. Fiona Ken's presentation earlier, and I would like to know further about that and then how we implemented the sustainable IPE in this pandemic situation, because surely the pandemic is not over yet with the new variant of virus and stuff like that. We still have like boundaries to follow in here. Please, Prof. Fiona. It's still on mute. Pardon. Okay.
I just wanted to clarify which piece of work. Do you mean the article that I showed, the screenshot?
Yeah.
Or sustainability? So there's two big pieces of work. There's some interprofessional curriculum we're doing with students around sustainability more broadly. And then there's the sustainable interprofessional, so activities that students can do on placement that aren't dependent on facilitators and training and workshop. So which piece of work did you want me to talk about?
Yeah, regarding the students' activities
in the hospital
workshop. Yes.
Yeah. Okay. So, and I did put in the chat actually with my colleagues at the University of Sydney. This is really around designing interprofessional activities that we send our students to do when they're on placement. So you're there for 6 weeks, 5 weeks. While you're there, there's an activity you would need to do that's interprofessional. And through Sydney, there's sort of 4 main ones. One is you can go and shadow somebody who you don't know what they do. So go and spend the afternoon watching the occupational therapist, and they will take the patient on a home visit or look at them in the kitchen or whatever it is. So one is observation, and then talk to them about what they do. So you would say, okay, so as a doctor, when would I want to refer to you? What sort of things? And then they write a reflection. So that goes into their portfolio, and that's an assessment task. So I haven't had to teach anyone. I haven't had to do staff development. I've said, go and find someone in the hospital that is relevant. And even the act of the student having to approach them to say, hi, I'm a 4th year medical student. I really don't understand the role of the OT. Do you mind if I spend, the next hour watching your assessment or swallow assessment or whatever? So that's one activity that we did. Another one is where we utilise the team meeting. So students often in our setting, a case conference or a team meeting, they will be able to sit in that meeting. So we ask them to do a task. So if you get to a team meeting, there's some prompts you want to do. Who's in the team meeting? Do you know what everybody does? How well do you think the team functioned? Did everyone have a say? Was it respectful? Are there any things that you think could have been done better in that team meeting? So you're asking the student to analyse teamwork. And so that also asks that they might need to go and talk to people after the meeting to say, there was a person sitting on the other side of the table. I don't know, was she the registrar? Was she so basically saying, if you don't know who's around the table at the end, find out what their role is. So that's a second task that we use. A third task that we commonly use is we ask a student to interview a patient and ask them about all the people they see. You see many health professionals, tell me who you've seen, and they will say, I see the psychologist for this, I see the doctor for this, I see whatever. And we also ask, the prompt question is, how well does your whole team communicate? And often the patient will say, well, someone didn't get the letter from the whatever. So the student gets from the patient the team story. So that's another sustainable activity. So for example, in our nutrition and dietetics course, they have to do one of those on every rotation to interview the patient and say, who's in your team? how well do they work together, and what would you like to see done differently? So the students find that incredibly useful, because they had no idea that the patient that they saw, say for a gut problem, was actually seeing 7 health professionals for everything from their, the rheumatologist and the orthopedic surgeon for the whatever. So hearing from a patient all the story. The final one is where students can join other students. So say on their placement, there's 2 professions there. On that ward, there's medical and nursing students. There's a whole lot of things you can do to say, okay, you can together do a task or whatever. So that's what we call sustainable, because it's not dependent. I don't have to schedule it, in answer to your question earlier, to say, how do you schedule everything in the workplace? I don't schedule it. I say, you need to work this out at some point. You've got 6 weeks on that placement. At some point, you need to write about a team meeting. At some point, you need to, shadow another clinician, whatever. So some of those activities have been really good, because it's flexible and not dependent on us over engineering it, and it's authentic. And in answer to I think, who is our dentistry colleague earlier? Let's see in the chat. The idea that it needs to be authentic. The student needs to know how their profession interacts with others. So that way you turn it around, rather than you designing it, the student is utilising the existing amazing curriculum that our healthcare system is naturally.
Yes, thank you very much for the answer. It's really practical for us that have the scheduling problems that really suit really well in our curriculum. Dr. Boy, could you add a little bit about the answer?
Yeah.
Is that suitable for our programs over here?
Yeah. It's very suitable, because before we conduct the academic scheduling, we must consider about the stakeholder, which is the dean of the head of study program. Is they are commit for the IPE. If they are commit for the IPE, I think it's easy for us to make an academic schedule, but for all the study program, because in UNS we have 2 faculty and 3 study program. And for 2 faculty, we must consider about the 2 deans, and for 3 study program, we must consider 3 head study programs. So if we have the commitment for the IPE, I think the head study program will be follow the rule of the IPE team, what kind of the situation, what kind of the learning activity, and what kind of the design of the learning process. I think we can suitable for us to make IPE more running smoothly.
Okay,
thank you very much for adding the answer.
The other thing is to think about and, not or. So there's many options. It's not just I needed it's not a pill. IPE is not a pill. You can take a tablet and you become a team worker. Interprofessional learning is just like everything else on the continuum. You know, yes, a little bit, then you know a bit more, and then you can know so much more. So I think absolutely, as Dr. Boy said, we need clear curriculum, and those activities I was saying, they're in addition to all our structured programs. So so to think and not or, and not it's not a there's not a simple dose you can take to say, well, I did my workshop in 2nd year, I'm a good team worker. It just doesn't work that way. Teamwork is complex, and it differs in different settings. We need to always think of that whole continuum, not just a single thing that you need to put in and then they come out the other end as team workers.
Yeah, I'm very agree with Fiona. Very, very agree.
Yes, that's true. You cannot be like instantly become a team player in overnight. Thank you very much for both speaker, Prof. Fiona Ken and Dr. Boy, for really fascinating presentation and Q&A sessions. I'm afraid our Q&A time is finished, so we move to the next agenda in this webinar. I believe there is something that the community will give to Professor Fiona Ken and Dr. Boy. Yeah, let's share. This is the certificate of appreciation presented to Associate Professor Dr. Fiona Ken as the speaker in this third International Continuing Medical Education Series, or INCOM's IPE, from Basic to Practice, Faculty of Medicine, Universitas 11 Maret. Thank you very much, Prof. Fiona, for your time sharing your valuable knowledge for all of us.
Thank you so much. It was a pleasure.
Yeah, thank you so much. And then the second certificate is to Dr. Boy, Dr. Amanda Boitimore. This is the certificate of appreciation as the speaker in this webinar, the third International Continuing Medical Education Series, INCOM's IPE, from Basic to Practice, Faculty of Medicine, Universitas 11 Maret. Thank you very much, Dr. Boy, for sharing your valuable knowledge.
Very welcome.
Yeah, I hope these collaborations not only stop in here, it will be continuous to the next event and next chance for us to do another program. Thank you very much. And with that, I close the session for this webinar, and I will bounce back to our Master of Ceremony, the Bu Amalina, Mrs. Amalina. The time is yours, and thank you very much.
Yes, thank you very much, Dr. Widana, for leading such a stimulating discussion. Ladies and gentlemen, this is the end of today's lecture. But before closing time, we would like to have a photo session first. Everyone, please turn on your camera for a virtual photo session. Okay, I will start from page 1. Okay, is everyone ready? Okay, I think we'll wait for a couple of seconds first. Okay, I'll start from page 1 on the count of 3. 1, 2, 3. Okay, move to page 2. Okay, 1, 2, 3. Okay, on to the next page, page 3. 1, 2, 3. Okay, next on page 4. Okay, 1, 2, 3. Okay, and to the last page. 1, 2, 3. Okay, perfect. Thank you, everyone. And thank you, everyone, for joining us this afternoon. It sure was an informative talk from our wonderful speakers today. We have Professor Fiona and also Dr. Boitimore. The committee would like to express sincere gratitude for your vast knowledge and expertise. We hope to see you again in our next collaborative event. We also like to say thank you to all UNS IPE field instructor from the Primary Health Center and also UNS IPE supervisor from our faculty for joining today's lecture. Thank you for your time. On behalf of the committee, I would like to apologize for any inconvenience during today's event. Thank you and wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Fiona. Thank you, Boy.
Okay, thank you, Professor Fiona.